For a syncope patient, there are things that that patient can do to help to prevent episodes. And they're really pretty simple, but not always known. So the first thing is to drink plenty of water. And when I say plenty, I'm talking about 3 litres a day or 6 pints. And most people find that surprising. Second thing they can think about is salt. Now today, the media has been very successful in persuading people that a lot of salt is bad. And this has been good for the treatment of high blood pressure, but it isn't good for fainters. So I find that most fainters that I see are taking very little salt. "Oh, I thought it was bad," is the statement usually made. And the answer is yes, it is bad, but it isn't bad for you. So if we speak about the weight of salt that we should be taking daily, a typical normal diet will contain 5 to 10 grams of salt per day. And many people are consuming less than 5. So an adjustment there may be appropriate. And the point of that is that salt holds water in the body. So there's 3 litres of water with the extra salt, a bit more is held inside. The other things that patients can do is to be aware of situations in which fainting can occur. I may take the example, or a couple of examples, like parties. Standing up, hot room, not perhaps quite as much oxygen as normal. These are situations when patients faint. A little bit of alcohol can make fainting more likely to occur. The reason for this is that it opens up the blood vessels and, as it were, diverts some of the central blood, which is in heart and lungs and brain, where it's really needed. It gets redistributed to the legs and the arms and the skin. And it's kind of wasted there. I mean, it's really needed in the center. So I'm not saying don't drink alcohol, but it might be clever not to drink alcohol outside the home. Or if you go to friends for dinner or something, this can be a very relaxed circumstance and no problem. But parties and sometimes ceremonies, alcohol is consumed, and this can be more difficult.